So here we see the number of new cases in the United States, daily confirmed new cases. Now we had feared a continued upward trajectory. But as we can see here, according to this graphic, there's been a levelling off and even a reduction in new cases in the United States. Welcome to the video as always. And of course that would be remarkably encouraging if it wasn't for this information here that we reported on last week on this channel, Wednesday the 15th of July, 9 days ago. CDC being bypassed in the collection of COVID-19 data. Now must be submitted to Department of Health and Human Services. Hospitals ordered to send all COVID-19 patient information to a central database in Washington, D.C. And it just seems a bit of a strange coincidence that has given us this nice levelling off and drop rather than the continuing trajectory of increasing cases, getting onto the 80,000 new cases per day area that we had feared. Now, of course, I'm using my language very conservatively. This is nothing short of a national scandal as far as I can see. And I'm just amazed that American news outlets are not bouncing up and down about this now. I suspect they will be in the next day or two. So I expect you'll be hearing lots more of that from American news outlets from today onwards, I would have thought, because it just really begs credulity that there would be such a change when we know things are getting way, way worse. And so many people are suffering in the United States. Now, today's video is a bit unusual, really. It's not really what I planned. So what happened was I started looking at this Mike Pompeo, Dr. Tedros. What word should we use? Disagreement, spat, tiff. Anyway, and I kind of it reminded me of some of the things that the World Health Organization had been saying a while back. So I've kind of done a review of it. And the bottom line of this video is I think I've got firm evidence here that the World Health Organization have botched this up really quite big time. But if you want to stick around for that, more of that later. But let's just remind ourselves about this disagreement. Now, we mentioned the Mike Pompeo statement just recently. Now, certain people have written to me and they've very politely suggested that Mike Pompeo might have been guilty of the perpetration of a terminological inexactitude. At least I think that's what they meant by their comments. So having said that there's disagreement over the veracity of Mike Pompeo's statements, let's just remind ourselves of what he said. And I'm just going to do this briefly because we have done this already. So Dr. Tedros has struck a deal with China. It's political rather than science-based. Dr. Tedros was bought by the Chinese government, and Mike Pompeo saying he's got information that there was a deal made to support him, and an excellent candidate that I pointed out called David Nabarro was bypassed, who was, in my view, absolutely first-class candidate for the appointment, but Dr. Tedros got it. Dr. Tedros not being a medical doctor but being an academic. Now, pretty strong words there, to be fair, from Mike Pompeo. Many of you have suggested that it's not accurate, that some of you suspect that Mike Pompeo has committed terminological inexactitudes in the past. Not for me to say, but many of you believe that. Now, the World Health Organization, I'm actually a bit surprised about this, but they've actually fought back on camera to an international audience. So Dr. Tedros has actually said the comments are unacceptable, untrue, and without any foundation. Now, Mike Pompeo said he had a firm intelligence-based foundation. Dr. Tedros said they are without any foundation. Now, I'm struggling, but I don't think both of those can be true, do you? It sounds like one of these men is committing a terminological inexactitude. You can decide who it is. But certainly both of those statements can't be true. The entire focus of the organisation is on saving lives, and then Dr. Maria Van Kerkhove said she's proud to be a WHO employee. So the sort of top bods at the World Health Organization kind of sticking together there, which of course is very something or other. Now, going back, this got really interesting. Now, I went back and looked at what the World Health Organization have actually been saying. And I went back first of all, and it took a bit of ratcheting out, but I found a statement from the 10th of January. So this is the World Health Organization on the 10th of January. International traffic, the World Health Organization, no restrictions recommended. Now, make no mistake, this virus did not swim to the United States. It went there on an aeroplane. I suppose a few viruses transmitted around on ships. But the Bering Strait land bridge is now closed. It went there by ship or by aircraft. But the World Health Organization here recommending no restrictions recommended. Now, they said Wuhan City is a major domestic and international transport hub. Yes. Currently, there are no reported cases outside of Wuhan City. This is the 10th of January. And then they said this: given the heavy population movements expected to significantly increase during Chinese New Year. Now, if you've been following these videos, remember that Chinese New Year is like Easter, Christmas and bank holiday all rolled into one. It's a big deal in China. Everyone moves around. Very important for Chinese people to be at home during that period of time. So millions of people on the move. In the last week of January, the risk of cases being reported from elsewhere is increased. So yeah. So rightly, the World Health Organization is saying, look, Chinese New Year's coming up. Everyone's going to be shuffling around. There's cases in Wuhan at the moment. The risk of cases being reported from elsewhere is increased, obviously. And how did the World Health Organization respond? It's obviously there's an increased risk of cases in other places, so they respond by saying they do not recommend any specific measures for travellers. Is it just me? Or is that completely non sequitur, bizarre, inexplicable? You decide. 24th of January, moving on. Again, don't take my word for any of these. all the links are there. These are direct cut and paste jobs from the World Health Organization. This is not me. This is direct from them. Do check. The current outbreak originated in Wuhan City, which is a major domestic and international transport hub. Yes. Given the large population movements expected to significantly increase during the Chinese New Year in the last week of January. Yes. And they observed human-to-human transmission. So here, the World Health Organization know that there is all the movings and comings and goings associated with the Chinese New Year. And they're also stating observed human-to-human transmission. It is now known to be a human-to-human disease. So having said that they know there's going to be all this travelling around, having said they know there's human-to-human transmission now, they go on to say it is not expected that new confirmed cases will continue to appear in other areas and countries. This is not me making this up, honestly. So they know there's large population movements, they know there's human-to-human transmission, and they're not expecting cases to appear in other areas of China, presumably, or other countries. So we have a transmissible disease. This is me paraphrasing it. We have a transmissible disease. The world and his wife and her husband are travelling around all over the place, but we don't expect any more cases. It's the World Health Organization. That's what these are direct quotes. Do check it. It's not me making this up. With the information currently available for the novel coronavirus. 24th of January. 24th of January they went on. World Health Organization advises that measures to limit the risk of exposure or the importance of the disease should be implemented. So they're saying that people should risk exposure. They're saying that there should be measures to prevent the spread of the disease, but they're not expecting any. They're not expecting any cases to occur in other areas. And these measures should be implemented, hand washing, etc., but without any unnecessary restrictions on international travel. They're actually saying don't restrict international travel. It really is difficult to understand, because by this time they've established human-to-human transmission. 3rd of February. Now, this is interesting. This was in Reuters. Now, Reuters here, the Reuters report said, talking about the World Health Organization, this is what Reuters said, very reputable news agency, Reuters. There was no need for measures that, and this is quoting the World Health Organization, unnecessarily interfere with international travel and trade. So Reuters are here saying that the World Health Organization has said there is no need for unnecessary measures that unnecessarily interfere with international travel and trade. And Reuters say that the World Health Organization said that on Monday, and Monday was the 3rd of February. And I went to look on the World Health Organization site, and I guess it's because I'm such an inept literature searcher, I couldn't find their World Health Organization entry for that day. So Reuters reported it at the time as being the 3rd of February, but I couldn't find a briefing for the 3rd of February. You go and look and see if you can find one. Monday the 3rd of February. It is not on the World Health Organization website, meaning that I am very bad at literature searching, I guess. Because Reuters said it was there, but I couldn't find it. World Health Organization, 4th of February. It is important to understand that 99% of the cases in China and 97% of the deaths are in Hubei province. So it's important to understand this is a localized problem, basically, is what they're saying. This is still first and foremost an emergency for China. This is a Chinese problem, not an international problem. Carry on flying in and out of China. It's not an international problem. It's a Chinese problem, look. This is as late as the 4th of February. The World Health Organization, we continue to work closely with the Chinese government to support its efforts to address the outbreak at the epicenter. Fair enough. Oh, apparently that's our best chance of preventing a broader global crisis. I would have thought the best way of preventing a global crisis is to stop global travel out of China. But hey, what do I know about it? This is the World Health Organization. I mean, it really is quite incredible. At this stage, they're not recommending stopping flying, and the virus duly flew round the world. You decide from the data you've had so far, and there's more to come, do you think this pandemic was completely preventable? Everything that we've gone through, the deaths, the suffering, everything, do you think it was completely preventable? 29th of February, now we're getting really late now. 29th of February. Updated World Health Organization recommendations for international travel in relation to the COVID-19 outbreak. Don't take my word for it. Click on that. The heading was International Recommendations for International Travel. World Health Organization continue to advise against the application of travel or trade restrictions to countries experiencing COVID-19 outbreaks. Now, this is the 29th of February. Now, by the 29th of February, for weeks, some strange bloke in Carlisle had been looking at the data that was in the public domain, applying just a tad of common sense, and was bouncing up and down about this being a pandemic. go back and watch the videos I made at that time. I was warning about a pandemic way before the 29th of February. Not because I'm clever, just because I had access to the data and anyone could have worked it out. Apart from the World Health Organization, it would appear. Let me just read that again. 29th of February. World Health Organization continues to advise against the application of travel or trade restrictions to countries experiencing COVID-19 outbreaks. It's unbelievable. In general, evidence shows that restricting the movement of people and goods during public health emergencies is ineffective in most situations. So this is the World Health Organization saying that restricting the movement of people is ineffective at restricting the transmission of infectious disease. Unless I'm misreading it, but that's what it says to me. And these are direct cut and pastes from the website. Travel bans to affected areas or denial of entry to passengers coming from affected areas are usually not effective in preventing the importation of cases. Well, as I said, the virus is not going to swim. This virus was spread by humans to humans around the world. How the World Health Organization could say this on the 29th of February, to me, is quite inexplicable in terms of the most simple science as I understand it, and as you all understand it as well. It spreads from person to person, so stop people meeting people. From infected countries like China to non-infected countries like at the time the United States, just stop the transport. But no, they didn't seem to work that out. In fact, they had actively advised against it. But they did acknowledge, obviously, that it could have a significant economic and social impact. But I suspect if they'd done that at the time, the economic and social impact would have been less than the social and economic impact we are enduring now. 29th of February. Check it for yourself. Check it for yourself. 11th of March. Now, this was a joint statement by the International Civil Aviation Authority and the World Health Organization. So the International Civil Aviation Authority and the World Health Organization. Now, I read this whole report, and I must say it didn't make much sense, but remind stakeholders of the importance of following existing regulations and guidelines. No mention of stopping flights. That's on the 11th of March. You know, do you think from the evidence I've given you this pandemic was completely preventable? It is just incredible. And I feel, my view is there has to be some accountability for this getting it so absolutely, utterly wrong. These are the experts that we pay to get this right, and they got it 180 degrees wrong. There needs to be some sort of accountability here. We need people of... we need different people in charge, I think. David Nabarro will be a good place to start. Although he himself, of course, has said not because he doesn't want to cause trouble. Which, of course, is another reason to give him the job. Now, that's all I wanted to say really on this. I guess this is about information and communication. Let me just remind you of that screen we started it with. You know, we know these cases aren't dropping in the United States. Unless, of course, it was grossly inaccurate before, and now these are accurate reports. You can make your own mind up on that. Anyway, to close, the World Health Organization's latest report. Now, if it hadn't been for the previous reports, I think this one would probably take the biscuit. Again, I read the full transcript of the report, and it didn't really say very much, but it did say this. This is Dr. Tedros' open remarks. No matter where you live or how old you are, you can be a leader in your community. Not just to defeat the pandemic, but to build back better. So it sounds like Dr. Tedros is calling for multiple leaders. So now, no matter who you are, where you live, how old you are, you can be a leader. And then he says this: in recent years, we have seen young people leading grassroots movement from climate change to racial inequality. We now need young people to start a global movement for health, for a world in which health is a human right and not a privilege. So Dr. Tedros here seems to be calling on the young people around the world to become leaders. Now, if all the young people around the world become leaders, of course, there'd be no one to be led. It just struck me as utterly bizarre. What is he talking about? We need a few million Greta Thunbergs around the place. Or what does he mean? Isn't it the World Health Organization's job to lead? Anyway, I'll leave you with his thoughts. Now we need young people to start a global movement for health, not for a world in which health is a human right. In which health is a human right, not a privilege. I mean, we agree with the sentiment, of course. But I just found that somewhat bizarre, on top of things that you may wish to reflect on and look up the reference for yourself, because you may find it just too incredible to believe what I've just told you. But the references are there in the description, as always.